Now it's time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. New daily COVID-19 cases in South Korea topped 38,500 on Sunday. That is a record high for the country. On top of that, the number of infections is forecast to keep rising exponentially due to the highly virulent Omicron strain. Health authorities are saying they wouldn't actually be that surprised to see new daily cases in the six-figure range in the near future. On top of that, the accumulated virus caseload in South Korea has also exceeded 1 million just 2 years after the country reported its first case. However, the fatality rate is dipping, and the number of critically ill patients has dropped below 300 after being at around 1,100 a few weeks ago prior to Omicron's arrival.
And also from today, the current social distancing guidelines have been extended for another 2 weeks. For more, we connect on the phone with Dr. Alice Tan, internist at Ms. Mary Women's Hospital in Seoul. Good morning, Dr. Tan.
Good morning.
So firstly, considering the explosion in new cases, are you content with the decision to extend the current social distancing guidelines for another 2 weeks?
There's no question that the Omicron wave has the potential to bring about a huge surge in hospitalizations and deaths here in Korea. In the UK, where 65.2% of the population older than 12 years has received a booster shot, they are logging close to 639,000 new cases over the last 7 days. And at the peak of their Omicron wave, there were about 19,000 new hospital admissions per day. So extending the measures for another 2 weeks, I think, was the bare minimum to try to manage this current wave. Some parts of the country, such as the Honam region and Gangwon province, I think may have benefited from tighter restrictions, however.
Now, Doctor, when Omicron first hit South Korea a few weeks ago, officials were really sounding the alarm about the health system being overwhelmed like it never has been before. It's still clearly very tough for medical staff, but that did not happen. The health system is still functioning. So what do you think is really going on in that regard? And do we still trust at this point the current COVID prediction models?
Well, you know, hospitalizations and deaths always lag behind cases. First of all, as of February 4th, the number of COVID ICU beds available in the entire Gangwon province had fallen to 50. And on Jeju Island, there are only 22 ICU beds left. So there are already regions where the healthcare system is definitely feeling the strain of Omicron, and cases have not yet peaked. And so this is very worrisome. Secondly, over the weekend, we may have passed the inflection point in the epidemic curve of current ICU cases. After many weeks of continuous decline, the number of cases currently in ICUs has increased for 2 days in a row. And we will see this week if this is the start of a dangerous upward trend. Third, the number of cases aged 60 and older was nearly 5,000 yesterday, which is a new record for our country. And we have seen a steady rise in this number since January 18th. And the critical questions are, how many of these cases are unvaccinated or partially vaccinated? And subsequently, how many of these elderly, high-risk individuals will become severely ill? Lastly, there are some provinces where the epidemic surveillance system is so overwhelmed, they've essentially stopped reporting on active clusters. This indicates an escalation of transmission level from discrete clusters and outbreaks to widespread community transmission. And so I think the upcoming week to 10 days will let us know if our aggressive booster campaign was enough of a defensive barrier against the Omicron wave, because, as I said, there's always a lag time, and next week is when we'll find out.
And Dr. Tan, 85% of people in South Korea have had at least 2 COVID-19 vaccine shots, and well over half of the population has had a booster. Now, could this mean that vaccination campaigns are not working?
So clearly 2 shots are not enough to prevent infection with Omicron, especially if more than 3 months have elapsed since the second dose because of waning of effectiveness, or if the AstraZeneca vaccine was used for either the first or second dose of the first 2 doses. Some experts now consider the appropriate schedule for COVID vaccines to be a 3-dose prime series for most adults. In other words, you are not fully immune unless you have received 3 shots. And of course, in Korea, only 55% of our total population has received a 3rd shot. But the really important fact that must be recognized is that vaccines are holding their ground in terms of preventing many hospitalizations and progression to severe disease. So in this regard, vaccines are certainly working. Vaccinations are working. As of January 31st, vaccine effectiveness against death in our country was 87.7%, and against severe disease, it was 91.2%, which are both considered high levels of protection.
Okay, just briefly, I just want to pick on something you said there. You said that if someone has had a booster shot, they are immune from catching Omicron.
Well, we do have breakthrough infections after 3rd shot boosters as well. But in terms of your risk of hospitalization or death, it's much very, lower. Very low.
Okay. So finally, if South Korea follows what we've seen in other countries, which we expect it will do, we'll see this period of exponential growth in Omicron cases, then a kind of plateauing out. Now, countries that have completed that cycle, or many of them anyway, will or have already lifted all COVID-19 restrictions. In your view, once Korea comes out the other side of this, should it follow suit and we should make a real effort to go back to some semblance of normalcy?
So the decision to lift restrictions is very complex, and it depends on many different factors. First, I think if we look at the downslope of the Omicron wave in other countries, we'll notice that there is a lengthy tail with a high level of new cases. For example, in South Africa, their current 7-day average of daily new cases is still around 3,000, which is 10 times higher than their transmission level prior to Omicron. Back then, it was only 300 cases per day. So the question is, will hospitals have the capacity to deal with this high plateau that we will come down to? Secondly, I think a lot depends on the level of vaccination that we achieve in our country. If we can deliver 3rd dose boosters to 80 to 90% of the population older than 12, and 2 doses to 80% of children aged 5 to 11, then we can maybe think about easing some restrictions. But as it is, I think there's still too many people, about 3.2 million adults, who are either unvaccinated or partially vaccinated in our country. Third, in the context of suboptimal vaccination rates in the total population, the first-generation antiviral pills, that's molnupiravir and Paxlovid, I think they're too limited in their scope of use and effectiveness to allow for a full, safe return to normal. And lastly, by the time we hit our peak and then reach a new trough, that might be March, and who knows what new variant will be on the global radar then. Many countries on the African continent still have what we know. The Democratic Republic of Congo has a population full vaccination rate of less than 1%. It's 0.2%. The global community has been painfully slow to realize what it means when we say, no one is safe until we are all safe. So thinking about returning to normal when so many people on the planet are still not protected, I think is premature.
All right, Dr. Tan, as always, thank you so much for your insights, and we'll talk to you again soon.
Thank you.